Every day in my clinic, I see women over 60 struggling with a change no one prepared them for. Gynecologists worldwide are now raising the alarm. Several common hygiene habits older women trust, habits passed down, recommended by friends, or repeated for decades, are actually making intimate odor worse, not better. And the decline happens quietly. After 60, estrogen drops, the skin becomes thinner, the microbiome shifts, pH becomes more reactive, and the tissues grow more delicate. That means routines that were harmless in your 40s can suddenly trigger irritation, dryness, bacterial imbalance, and stronger, more stubborn odor in your 60s and 70s. But almost no one connects these changes to the hygiene rituals themselves. Women think their body is getting worse, when the truth is, it's the habit sabotaging the natural protection system they desperately need. I've cared for women who shower twice a day, yet the odor intensifies. Others scrub harder, use scented washes, stock up on wipes, switch soaps every week, or try freshening products, only to watch things get worse. None of them realize that after menopause, the intimate microbiome becomes extremely fragile. If you disrupt it, even slightly, the good bacteria die off, bad bacteria take control, the skin barrier breaks down, and odor becomes stronger than ever. And the heartbreaking part, women blame themselves. They think they're failing in hygiene, when in reality they're doing too much, not too little. That's why in this video, we will reveal the 5 hygiene habits gynecologists warn are making intimate odor worse after 60. And stick around because number 1 can trigger imbalance and odor more powerfully than any other routine older women accidentally use. All supporting medical references are included in the description. But before we dive in, here's a quick question. What's the number 1 hygiene or comfort issue you've noticed changing with age? Share your experience. Today, we're replying to every single comment personally, like a real conversation inside a clinic. Now, without any further delay, let's begin with number 5. And you might be shocked because this first habit is something almost every woman over 60 still does without realizing the damage. Number 5. Do not wear non-breathable underwear and tight clothing daily. Starting at number 5, we have a habit that seems completely harmless, but creates the perfect storm for odor problems, and that is consistently wearing underwear made from synthetic materials like nylon, polyester, or spandex, combined with tight-fitting pants or leggings day after day. Now you might be thinking, what does my underwear have to do with how I smell? The answer lies in basic biology and something called a microbiome, which is just a fancy word for the community of bacteria that naturally live on and inside your body. Your vaginal area is home to trillions of beneficial bacteria, primarily a type called lactobacillus. These good bacteria are like tiny bodyguards that produce lactic acid and keep the environment slightly acidic, which prevents odor-causing bad bacteria from taking over. But here is where synthetic fabrics become a problem. Unlike cotton, which is breathable and allows air circulation while absorbing moisture, synthetic materials trap heat and sweat against your skin like a plastic bag. Dr. Jennifer Gunter, a board-certified gynecologist and author who has spent decades studying vaginal health, explains that this warm, moist environment is exactly what harmful bacteria and yeast love. When you add tight clothing on top of synthetic underwear, you are essentially creating a sauna down there, and not in a good way. For older women, this becomes even more problematic because of something called vaginal atrophy, which happens when estrogen levels decline during and after menopause. The vaginal tissues become thinner, drier, and more sensitive. When you combine already vulnerable tissues with a hot, sweaty, non-breathable environment, you are setting the stage for bacterial overgrowth that produces those embarrassing odors. The bacteria that cause unpleasant smells, like Bartonella and Protella, thrive in exactly these conditions. The solution is straightforward, but requires a shift in your daily choices. Switch to cotton underwear for everyday wear, especially if you're going to be sitting for long periods or the weather is warm. Cotton allows your skin to breathe and wicks moisture away from your body. If you love your yoga pants or shapewear, that is fine for short periods, but try not to live in them. When you get home, change into looser fitting pants or a cotton skirt. At night, consider sleeping without underwear entirely to give that area time to air out. Some gynecologists actually recommend this as one of the simplest things older women can do to maintain a healthy vaginal environment. It sounds almost too easy, but allowing airflow can make a significant difference in preventing the bacterial imbalances that lead to odor. But breathable fabric is just the beginning, because the next habit on our list is something you might be doing in the shower every single day. Before we dive deeper, show your support by liking this video and subscribing. You can't afford to miss the next secret. Number 4. Do not use scented soaps, body washes, or feminine wipes down there. Coming in at number 4 is a habit that the feminine hygiene industry has actually encouraged for decades, and that is using scented soaps, perfumed body washes, or those convenient feminine wipes to clean your intimate area. Walk down the hygiene aisle of any store and you will see dozens of products marketed specifically for feminine freshness, promising to leave you smelling like flowers or tropical fruit. Here's the problem that gynecologists wish more women understood. Your vagina is not supposed to smell like a botanical garden, and trying to make it smell that way actually makes natural body odor worse over time. The science behind this is fascinating and a little bit counterintuitive. The healthy vaginal pH sits somewhere between 3.8 and 4.5, which is moderately acidic, similar to the acidity of tomatoes or beer. This acidic environment is maintained by those good lactobacillus bacteria we talked about earlier, and it is your body's natural defense against odor-causing organisms. When you introduce scented products, you are flooding this carefully balanced ecosystem with chemicals, artificial fragrances, and often harsh detergents that disrupt the pH and kill off the beneficial bacteria. Dr. Mary Jane Minkin, a clinical professor of obstetrics and gynecology at Yale Medical School, has described this as essentially carpet bombing your vaginal flora when you only needed to dust. For postmenopausal women, this disruption is even more damaging because the vaginal environment is already more fragile and prone to infection. A study from the Journal of Women's Health found that women who used internal feminine hygiene products had nearly twice the risk of bacterial vaginosis, one of the most common causes of strong vaginal odor, compared to women who used nothing but water. The irony is painful. The more products you use trying to smell better, the more likely you are to develop the exact conditions that cause bad odors. So, what should you actually do to keep clean without causing problems? The answer is refreshingly simple. For the external vulva area, which includes the outer lips and the skin around your vagina, warm water alone is usually sufficient. If you feel like you need something more, use a tiny amount of unscented, gentle soap on the external area only and rinse thoroughly. Never put soap inside the vaginal canal, and stay away from anything labeled as having fragrance, perfume, or deodorant properties. Those feminine wipes that seem so convenient are almost always loaded with chemicals and should be avoided entirely for regular use. If you are out and absolutely need something, look for wipes specifically labeled as pH balanced, fragrance-free, and designed for sensitive skin, but even then, use them sparingly. Your body has its own cleaning system that has been working for thousands of years of human evolution. Trust it. Now that we have covered what not to put on your body, the next habit might surprise you because it involves something most people consider basic bathroom etiquette. Number 3, do not ignore proper wiping technique and bathroom habits. Number 3 on our list is something many women have never thought twice about since childhood, and that is wiping technique and general bathroom habits. This might seem like the most basic topic imaginable, but gynecologists see the consequences of improper wiping constantly, especially in older women who may have been doing it wrong for decades without ever connecting it to odor issues. The anatomy here matters tremendously. The urethra, where urine comes out, the vaginal opening, and the anus are all located in close proximity. The anus is home to bacteria like E. coli and other organisms that are completely normal and healthy in the digestive tract, but can cause serious problems if they get transferred to the vaginal area. When you wipe from back to front, you are essentially scooping up bacteria from the anal region and dragging it forward toward the vagina and urethra. Over time, this can introduce bacteria that do not belong in the vaginal environment, throwing off the balance and creating odor-producing infections like bacterial vaginosis or even urinary tract infections. For older women, this risk is elevated because of those declining estrogen levels we keep coming back to. The vaginal tissues are thinner and more susceptible to bacterial invasion, and the immune response in the vaginal area may not be as robust as it once was. Dr. Lauren Stryker, a clinical professor of obstetrics and gynecology at Northwestern University, emphasizes that front-to-back wiping should be non-negotiable at every stage of life, but it becomes critically important after menopause when the body's natural defenses are diminished. Beyond wiping direction, there are other bathroom habits that impact vaginal health and odor. Many women rush through urination and do not fully empty their bladder, which can leave residual urine that contributes to odor and creates a moist environment where bacteria thrive. Take your time on the toilet, lean forward slightly to help fully empty your bladder, and make sure you are completely done before wiping. After wiping, some gynecologists recommend a gentle pat dry with toilet paper rather than aggressive rubbing, which can irritate sensitive postmenopausal tissues. If you find that toilet paper alone is not leaving you feeling clean, consider using a small amount of water on the toilet paper for the final wipe, or invest in a bidet attachment, which has become increasingly popular and can provide a gentler, more thorough clean than paper alone. Bathroom habits are something we do multiple times every day without thinking, which is exactly why getting them right matters so much over the course of months and years. Number 2, do not stay in wet or sweaty clothing after exercise or swimming. At number 2, we have a habit that catches so many active older women by surprise, and that is the tendency to stay in wet swimsuits, sweaty workout clothes, or damp underwear for extended periods after physical activity. Maybe you finish your water aerobics class and run a few errands before heading home. Maybe you have your morning walk and then sit down to answer emails about changing first. It seems harmless, and honestly, who wants to deal with changing clothes multiple times a day? But this habit creates an environment that is essentially a breeding ground for the bacteria and yeast that cause strong, unpleasant odors. The science here is straightforward but important to understand. Moisture against skin creates what microbiologists call an occlusive environment, meaning air cannot circulate and moisture cannot evaporate. The bacteria that cause body odor, including vaginal odor, love these conditions. They multiply rapidly in warm, damp environments, and as they grow, they produce waste products that are the actual source of bad smells. When you stay in wet or sweaty clothing, you're giving these bacteria a feast and perfect conditions to reproduce. Within just a few hours, bacterial populations can increase dramatically. For older women, this is compounded by changes in skin integrity and immune function. The skin around the vaginal area may be more prone to irritation and minor abrasions when damp, which creates entry points for opportunistic bacteria. Studies have shown that women who frequently wear wet bathing suits have higher rates of both yeast infections and bacterial vaginosis, both of which can cause noticeable odor. Dr. Alyssa Dweck, a practicing gynecologist in New York and author of several books on women's health, regularly advises her patients that changing out of wet clothes should be treated as urgently as the workout itself. The fix requires a bit of planning, but is absolutely manageable. When you go to the gym or pool, pack a complete change of clothes, including underwear. As soon as you finish your activity, change into dry clothing before doing anything else. If you cannot shower immediately, at least get out of the wet items and into something dry and breathable. Keep spare underwear in your car, your gym bag, or your purse, so you always have an option. For swimmers, consider changing out of your suit at the pool rather than wearing it home. These small adjustments take just a few minutes but can prevent the bacterial overgrowth that leads to persistent odor issues. But as important as staying dry is, there is one habit that tops them all, one that gynecologists say causes more problems than anything else on this list. Number 1, do not douche or aggressively clean inside the vagina. Here is the number 1 hygiene habit that gynecologists are practically begging older women to stop, and that is douching or aggressively cleaning inside the vaginal canal. Despite decades of warnings from the medical community, surveys show that around 1 in 4 American women have douched in the past year, with rates even higher among women over 50 who grew up in an era when douching was considered normal feminine hygiene. This practice is not just unnecessary, it is actively destructive to vaginal health and is the single biggest hygiene-related cause of the odor problems women are trying to prevent. Let me explain exactly why douching is so harmful, because understanding this will help you never want to do it again. The vagina is a self-cleaning organ. It produces discharge that carries away dead cells, excess bacteria, and other debris. The community of beneficial bacteria that lives inside maintains the acidic pH that prevents harmful organisms from taking hold. When you douche, which involves flushing water or a cleaning solution up into the vaginal canal, you are washing away this entire protective ecosystem. You are killing the good bacteria along with the bad, stripping away the natural discharge, and disrupting the pH balance that keeps everything in check. The research on this is overwhelming and consistent. A landmark study published in the American Journal of Obstetrics and Gynecology found that women who douched regularly were 3 to 4 times more likely to develop bacterial vaginosis than women who never douched. Bacterial vaginosis is the single most common cause of vaginal odor, producing a characteristic fishy smell that can be quite strong and persistent. So women who douche to eliminate odor are actually dramatically increasing their chances of developing the exact condition that causes odor. It is a vicious cycle that gynecologists see constantly, where women douche, develop bacterial imbalances, notice more odor, douche more aggressively, and make the problem even worse. For post-menopausal women, douching is particularly dangerous because the vaginal lining is already thinner and more vulnerable to damage. The physical act of inserting a douche and the pressure of the fluid can cause tiny tears in the tissue, which then become sites for infection. Dr. Jen Gunter, who has become something of a crusader against douching, points out that the vagina does not need to be sterilized any more than your mouth or your gut does. These are all areas of the body that depend on healthy bacterial communities, and destroying those communities creates far more problems than it solves. If you have been douching for years or even decades, the good news is that your vaginal flora can recover. Stop douching completely, switch to the gentle external-only cleaning practices we discussed earlier, and give your body time to restore its natural balance. For most women, this takes a few weeks. If you're experiencing persistent odor even after stopping douching and adopting healthy hygiene habits, that is absolutely a reason to see your gynecologist, as there may be an underlying infection that needs treatment with antibiotics or other medication. But the solution is never to douche more. The vagina knows what it is doing. Trust it. So there you have it, the 5 hygiene habits that gynecologists warn are making older women smell worse instead of better. From wearing non-breathable fabrics to using scented products, from improper wiping to staying in wet clothes, and most importantly, from douching and overcleaning, these are mistakes that millions of women make every day with the best of intentions. The common thread running through all of them is that they disrupt the natural bacterial balance that your body works hard to maintain. When that balance gets thrown off, odor-causing bacteria move in and take over. The beautiful thing about this information is that the solutions are all within your control and do not require expensive products or complicated routines. In fact, they mostly require doing less rather than more. Wear cotton underwear, use only water or gentle unscented soap on external areas. Wipe front to back, change out of wet clothes promptly, and please stop douching entirely. Your body is an incredible machine with systems that have evolved over millions of years to keep itself healthy. The best thing you can do is support those systems rather than fight against them. If you found this information helpful and want to see more content about women's health, especially topics that matter for those of us getting older, please hit that subscribe button and tap the notification bell so you never miss a video. We cover topics that really make a difference in daily life, the kind of information that can change how you feel and how confident you are as you age. Drop a comment below and let me know if any of these habits surprised you or if you have other health topics you'd like me to cover. Thank you so much for watching.